or the young or gambling and pathological use. The one that is covered there is loss of relationship.
And to use the usual term that this generation will use, when somebody chop breakfast, they are more likely to attempt suicide. Next slide, please. So we looking at relationship factors that can promote suicide. When somebody comes from a dysfunctional family, when the family, the parents are always at loggerhead, there's a lot of trouble in the family, the home environment is toxic, it increases the risk for suicide. When there's poor interaction between the parent and the child, not just, when the initial one is maybe parent to parent, and then the parents kind of put the children in between and they are caught up in the fight. And when children have issues with relating with their parents, it increases their risk of suicide. When somebody is a victim of bullying, it increases the risk of suicide. We'll see why all these things are important as I go on. So, or people that have been sexually abused. When a parent attempts suicide, the child also is at higher risk of suicide compared to those who do not. In the presence of parental mental disorders, and then when somebody has poor social support, trauma or abuse, all these relationship issues increases the risk for suicide. Let's go on to look at the community factors next. Next slide. So when we are looking at the community and societal factors, in the last slide, one thing that I forgot to mention in that slide is the fact that when there is access to means, homes where the parents are farmers and they keep herbicides in the home, or homes where for some reason the parents have access to guns and they have guns in the home, when there's access to the means of committing suicide, it actually increases the risk of it. Community factors, things like disaster, wars, people that are being discriminated against, maybe for religious purposes or for whatever purpose, that are at higher risk for suicide. When there's social isolation and when there's social exposure to suicide, this is very important, and I will talk more about it when I'm talking about media engagement. When a suicide happens and that suicide is reported and is not reported responsibly, what you discover next is that there many copycat suicides happen after then. There have been issues. I know some of us will remember these incidents in Lagos where somebody jumped over the Third Mainland Bridge. And if you remember, following that, over the next few months, we had 2 similar incidences of people trying to jump over the Third Mainland Bridge. So when suicide is not properly reported, it can actually prompt more people to attempt it. And this is even more so when you have celebrity suicides. When somebody that everybody that people know them, they are glamorous people, they commit suicide. It makes suicide look like something that, so that you too can belong and be glamorous. It's something that must be tried. So reporting of suicide or social exposure to suicide is one of the things that can put somebody at risk. Some people, when there's high economic distress in the community, there's lots of poverty, there's lots of trouble. When there are weak safety regulations and laws, because people have access to what they can use. One of my friends that recently traveled to the UK, one of the things she discovered was that, you can buy knives everywhere here in Nigeria. One of the things that is discovered that was a shock to her was she couldn't buy a knife openly. She had to ask permission to buy a knife. You literally, if you are young, if you are a young person, you literally might need like a police report just to buy a kitchen knife, because they're trying to restrict means, access to means. Unlike the US where everybody owns guns. And instead of addressing easy access to guns, they're saying it is not guns that are killing people, it is people that are killing people. So those are some of the things that needs to be addressed. When there's easy access to the means, and years ago, I will also still come back to it when I'm talking about prevention. Restricting access, including not making the things that people use to commit suicide readily available and easy to access, is one of the things that will be very important. Where mental health is stigmatized, it also increases the risk for suicide. Next slide. I shouldn't talk about risk without telling us what can protect us from suicide. These are some of the things that, if you have, is protective from, actually attempting or thinking about suicide. People that have life skills are less at risk of suicide. And these are things that we can all learn. So life skills are important. Things like decision making, critical thinking, problem solving, coping skills, skills that generally help us to live our day-to-day and adapt and cope with day-to-day problems are very important for coping or not being involved with suicide. And people that have good self-esteem and self-worth, there's some people that, when you encounter them, even though they have nothing, but the way they will speak, you think they actually own the world. People that have good self-esteem, they are less prone to suicide. And those that have a strong sense of purpose in life, they are driven by something. They know where they're going. They know what they want to achieve in their future. They are less at risk for suicide. And when people have somebody or something to live for, I love my parents, I love my child, so because of my child, I don't want to end it, even though I feel so bad. So having something to live for is very important. And then when you have good relationships, supportive relationships, they're very, very important. I will delve more into this. Let me not go into it now. When you have a sense of cultural identity, cultures that are very cohesive, where people look out for one another, the risk for suicide is lower. Another thing is when you feel connected in school. I mentioned social isolation as a risk, but those that feel very connected with other people in the community and in the school, they are less at risk for suicide. In terms of societal factors that protect, reduced means to access, we can't overemphasize that. Ethical media reporting, we also can't it should be media, not media. When there's increased mental health awareness, it increases that. And then when we also have access to help, when there is a need for help, all those factors are protective. Next slide. So I'll be using this document prepared by the Federal Ministry of Health kind of as a guide to walk us through suicide prevention. And it's something that any organization can use to kind of develop their own suicide prevention program. So I'm introducing it. I'm in Osun State University, so I guess I'm introducing it to the Osun State University. So it's a document that was prepared by the Federal Ministry of Health of Nigeria. And this was developed for two reasons. As a response for the increase in media reports of suicide, especially amongst young people. So we need to target young people if we're going to deal with suicide. It was also to help Nigeria attain the Sustainable Development Goal, which suicide prevention is actually one of it. And the goal is to reduce suicides in Nigeria, the suicide rate in Nigeria now, which is estimated about 12.9 per 100,000, to reduce that by 15% by the year 2030. So that is the purpose of this document. Let's move on. So this document uses a three-tier approach for suicide prevention. One is at the individual level, then at the community level, and then at the policy level. Next slide. So at the individual level, typically we use this framework to build interventions for suicide prevention at the individual level. One is, all the three approaches need to be used together, but they're just put together so that we know who each level targets. For example, the universal interventions, this is targeted at everybody. It might be the entire school environment. It might be an entire community. And what do they do at the universal level? They are more like education approaches. Some of us, when we were in primary school, there was a time they used to do this life skills training. So it's kind of like that, where everybody must participate in those sessions. And in those sessions, it's generally teaching people about life, about coping, universal things that can build resilience. All those protective factors that I mentioned earlier. It's trying to help people to learning problem-solving skills, learning coping skills. And it is targeted at the entire population. The next set of group of interventions are selected or selective or targeted interventions. There's some people based on, what I said earlier, that are increased risk of attempting suicide or actually dying by suicide. So the targeted interventions are for those kind of people. People that are involved with a disaster, for example, people that are going through a particular crisis, people that are being bullied, people that belong to maybe a community or a group of people that are being castigated. Those people will be for this, the targets or people that have been raped, survivors of rape. Those ones will be people to target for the targeted interventions. And then the indicated interventions are for people that actually have exhibited a suicidal behavior. They've attempted suicide before. So we want to prevent them from doing that again. And one of the things that is done here is to have crisis call numbers where people can call when distress. And so that's what the indicated interventions are for. And then also identify those who have mental health problems that can be targeted for treatment so that it can prevent them from actually doing it again and trying to kill themselves again. Next slide. So the community level interventions is similar to what we're doing now, raising awareness of the problem, making us to understand that this problem exists. So it's targeted at the general population. It will increase attitude, and then to also promote a healthy attitude towards suicide or suicidality. And the other thing at the community level is limiting access to means of suicide. I remember at a point when a lot of young people were taking sniper. That's when I think the government put out a notice that it should not be sold anymore in the large containers. Before you could buy it in large containers. Because of that, it now has to be sold in smaller containers. That's one of the things, trying to limit access to the means. In places where they discover that there's a particular bridge that people jump over when they want to attempt suicide, the thing is to put guardrails that will not allow people to be able to go through and jump to try and kill themselves. So limiting access to it, because sometimes when somebody wants to, has an acute crisis, really feels like dying or killing themselves, if for a moment something can just delay that point, something can just keep the person from doing it at that point, the person may not do it again. Let me give an example. Years ago, we had somebody that worked with us that at a point developed suicide thoughts, and she also had a mental illness, and she actually wanted to kill herself. But for whatever reason, which most people that have suicidal thoughts will do, she decided to call a friend. Unfortunately, the friend she called is a mental health nurse. So when she's told the friend, the friend now started asking questions. I said, well, after I drop the call with you, the next thing I'm going to go and do, I've already prepared it, the poison that I want to use to kill myself. So what that person did was to engage her all through, and then was able to get somebody else to call someone that lived close to her and say, please go to her house. So he kept her on the call till that other person got there. So they were able to rescue that life that day. So restricting or preventing the person from taking action at a point might actually save the person's life. So improving access to mental health services is very important. Having crisis response centers and interacting with the media for responsible reporting of suicide. Because the way the media reports suicide can either hamper our efforts at suicide prevention or aid it. Next slide. At the policy level, there has to be good legislation, and I've mentioned it before. In Nigeria, we need laws that will decriminalize. We need to change our laws and remove suicide attempts from being a criminal offense. And there has to be multi-sectoral interventions. If you look at all the causes or the things that put people at risk, you discover that they are not just health problems. It's related to agriculture because food insecurity is there. It is related to social welfare because social connectedness, poverty is part of the things we need to address. Related to education sector because we need to build resilience in students. So all those things, there has to be a way of bringing together all the important people. And funding is very important. We can't do anything without funding. And Nigeria, I am glad to say, we have a lot of policies, what we plan. So we're hoping that's part of the reason why I brought this here, that your generation will be much better than the previous generations, because that's the key thing. If we have all these things on the book, but they're not being implemented, it's as good as not having them. So we need these policies implemented to protect people. Next slide. So to begin to wrap up, every conversation counts. So I'm going to just highlight the important conversations we need to be having amongst ourselves and across different stakeholders for us to be able to be effective in preventing suicide. So let's start with ourselves. Next slide, please. So one thing that is important, if we're going to start with ourselves as youth, because as I've mentioned, the peak age for suicide behavior and suicide in Nigeria falls roughly between the ages of 15 and 34, which is the age range where most of us in this audience fall into. So if we're going to do anything in preventing suicide, we need to work at this age. And the first thing that we need to do is to raise awareness through this program. So let's appreciate the Still Waters for this beautiful program. So it's part of the things that we need to do to take this conversation forward. And another thing that we can do within our school communities is to have flyers, posters, telling people about this problem. And we shouldn't stop at just telling them. We must tell them where they can find help, because that is more important than actually talking about the problem. If we talk about the problem without mentioning the solution or where people can find help, then we have really not solved the problem. So that means there has to be a structure in place for helping. We'll get there. And then there is, in places where it's going to be effective, there has to be champions amongst us youth. And when I'm talking about champions, people that will promote mental health, people that will promote information about suicide and mental health, and those that will support those that need help to get the help they need. So we need champions like that amongst us, and I'm sure that's one of the things that Still Waters will be doing, raising champions for mental health all over. And we also need to build life skills and resilience. In times past, you might be thinking, who will teach me? But now with internet, you literally can enroll on different programs that can help you build life skills and resilience. So it's very important. Let's encourage ourselves to build life skills and resilience. People have been failing exams for generations. Are we following me? But nowadays, because resilience has not been developed, a lot of people, because of failing exams, will attempt to end their life. And one of the things that is important is just to build life skills and resilience and problem solving. Problem is always a part of life. What matters is how you deal with that problem. Some people, when they are faced with problem, will face it headlong and find solution to it. Some will try and avoid the problem until it becomes a bigger problem, and then they begin to think of killing themselves. So we need to build all these skills. We need to be responsible with our use of social media. That's very, very important. Thank you. Thank you. We need to be very responsible with how we use social media. Because social media, with access to social media now, people can Google and research literally anything. And then now there's literally nothing that is not posted on social media. There are people that post the process of how they attempt suicide on social media. So you need to be cautious of which kind of sites you visit, what kind of things you do when you're on social media. Another thing that is important, we need to avoid all these things that can put us at risk of suicidal behavior or suicide, and that includes substance use and gambling, which is becoming much more pronounced now, especially with all the sports betting. I've had to handle a young man that attempted to kill himself after he was given money to go to school, and then he used his entire school fees to gamble, and then he couldn't come to school, neither could he go home. So it became a problem. So those things can increase risk. So we need to avoid all those things that can put our lives in danger. We also need to seek supportive relationships. Nowadays, we are all together, but we're not making conversation. There's a lot of conversations, interactions going on, but not the real ones that needs to be built. I recently read a report of the Surgeon General in the US, he decided to visit school campuses. And one thing that struck him when he got to school campuses, he will enter their cafeteria, and he discovered that the cafeterias were very silent. And he just couldn't relate, because remember that when he was in school, cafeteria was where everybody hung out, and there would be a lot of noise, people gisting and everything. Now everybody was on their headphones, so the place was as silent as a graveyard. So that's why nowadays you see a lot of schools are beginning to move towards actually banning the use of devices and use of social media, because even though we're communicating, but really we're no longer interacting. And social connectedness is protective. So we need to get back to actual physical connectedness, not Facebook friends. I often tell young people, if you do social media, sometimes social media can actually make you depressed. Let me tell you why. People post good things on social media. It's the day they get chicken to eat that they will post. The day they don't have meat on their food, they will not post. So when you are looking at social media, your impression will be, this person is rich. But the person actually may not be rich. So we need to be careful and cautious of how we use social media. So let's increase actual social connections. And when we have a medical or mental health problems, please let us seek help early. Seeking help early can actually prevent all the other things that can follow. And there has to be we all have to have somebody we can call when there's a crisis. Like the example that I gave of a staff in our place. It was because she had a friend she could call and converse with. That was what protected her at that time. I was recently conversing also with another young lady, and she was like, she's been having suicide thoughts for a while. And I was asking her, who can you call? She said, I don't like to bother people with my problems. I said, there has to be someone. He said, the only person is my mom. I don't want to bother her. I'm like, look, I'm a mother too. I won't feel bothered if you are calling me because of that. So please, let there be somebody you can talk to when you are in crisis, so that we can avert the escalation of the crisis. So what are the conversations? The next slide. Conversation that we need to be having with families, because that's also very important. We need to help families to dispel the myth. There's a lot of myth around mental health problems and suicide. Some people believe that if you talk to people about suicide, then it will push them to do the act. It's not true, because you will learn that the person wants to do something. You know what the person wants to do, and then be able to gently turn the person away from it. There are a lot of beliefs about mental health problems, especially in our community. We believe that they are spiritual problems and they are not medical problems. So we should rather take them to the imams or take them to the churches and the pastors for deliverance rather than bring them for treatment. And so many times, people now go on with this illness for a long time, and then the illness becomes more difficult to treat, or people actually die by suicide just because of an untreated illness. So we need to dispel all these myths. We have to have open conversations about mental health and well-being in our homes. A lot of homes, we don't like talking about our emotional health, especially in our context, because we feel it's a weakness to talk about emotional health, especially for the boys. The boys too have emotions, don't they? They do, right? Boys have emotions. So we need to have open conversations about this. And we know 90% of people that would die by suicide would have spoken to somebody in the previous few weeks, and they would have provided hints. Some of them will say things like, don't worry, very soon you won't see me again. When people begin to say things like that, please let us sit down with them and talk more with them, because they begin to drop hints about it. So it's important that we catch the hints. And for families, we should create a healthy home environment. Let's reduce the toxicity, fighting, screaming at one. And sometimes children are sometimes better off raised by a single parent than by two parents that live together in a very toxic relationship. So those are some of the things that we need to also think about. Another thing for parents in the audience, a lot of us are helicopter parents. And helicopter parents are parents that they are just overprotective of their children. So the children are not being raised to weather every storm. You were raised to weather storm, and then some parents will be, I don't want my children to go through what I went through. What you went through is what made you resilient and able to weather storms. So when we protect our young ones from experiencing and learning skills that can help them to grow in life. We're really not building them to live in this world. So we as parents, we also need to address some of these things. And we need to please check in with your family members regularly. Let's stay connected. Let's check in with one another. And let us also in every home reduce access to the means. If you are a farmer or you have insecticides in the home, please keep it well labeled and keep it away from where it is accessible. We've seen young children, they didn't know what it was. They thought it was water, and they've drank sniper before. So we've seen parents that carelessly will leave bowls of water in the passage, and the child that is crawling will crawl into that. So those are some of the things we need to reduce. All the means that people that can be, accessible. We've had people with swimming pools in their house, and some people drown in the swimming pool. So all those means, families have to work with protecting themselves, and families should not shy away. A child has depression, anxiety, needs to seek mental health treatment. Please, families should be encouraging. Let's be open about it. The more open we are about these conversations relating to mental health, the better our society would be. Next one. I'm in a school environment, so I need to also talk to the lecturers. What kind of conversations do we need to be having in the schools? Schools should get informed, and also lecturers get informed about these issues, and also be at the forefront of contributing to raising awareness. And every school should promote a safe environment for all. School environment should be free of bullying and sexual harassment. These are things that occur in a lot of campuses, which we need to address. There's some lecturers that, in fact, attending their class could be very toxic. As far back as when we were in school, there's some lecturers that when you enter the class, you enter class with trepidation because you don't know what is going to spring on you that day. There's one of our lecturers then that, like we're sitting like this is how the lecture hall is. And he will start from the first person, asking very questions that he knows we cannot answer. Because except you have read the very big textbooks, you can't answer those questions, and we're green. And then he will ask, and the next thing is, out, you know nothing. Next, out, you know nothing. Next, out, you are stupid. And those kind of environment does not promote learning. All it does, it makes the young people to have low self-esteem, which can trigger suicidal behavior. So we have to have a safe environment for everyone in the school. And we also have to have appropriate policies in every school. Policies that target bullying. And then there has to be pathways through which you can report. Policies that target, that are against sexual harassment. And there has to be pathways for people to be able to report these things. So schools have to have effective policies in place. Policies that support mental health services or counseling services. Schools should have hotlines or a place where people can call. And especially around times of crisis. I remember years ago, our department had to be called in. There was a crisis between the school management and the students, because the students started protesting that they were not going to pay fees. And unfortunately or fortunately, it was around the time when they said just completed their exams. And the management was insisting, if you don't pay fees, we're not going to release your results. And there was a lot of uncertainty about who has passed, who is graduating, who is not graduating. And the next thing that happened was that one or two of the students actually attempted suicide. So the department had to be calling to now start, support systems. We had to be giving phone numbers because, the students were not ready to bow for management. Management was not ready to bow to students. So schools have to have structures in place. It shouldn't be at such emergencies that we're now developing hotlines and who people can call. So there should be counseling services in place in schools to support people that have either mental health problems or emotional problems and they need somebody to talk to. Anti-stigma programs are also very important. Schools should also work towards limiting access to lethal means. And there has to be responsive health system in place. The school health clinic should have mental health services integrated within it. And we have to work on training those that work there. And then there has to be a system of screening where when students come in, there are questions that we can ask so that we can identify those who are at risk. So those things are important. and there has to be how we can avert crisis. Next slide, please. And then for media practitioners, we have to train media practitioners on responsible reporting of suicide. This is a WHO guideline that is actually developed for this. And let me also state this. With social media and our phones, every one of us, we've literally become media practitioners. We are all reporting something and creating content. So we also should get ourselves familiar with this reporting system. In the context of today, you see somebody that's about to kill themselves. What do people do? What do people do? Somebody wants to jump from upstairs. They will bring out their phones and then they begin to record without anybody thinking, I can actually save this life. I can actually prevent this death. And then some people are not just reporting it, they are broadcasting it live on Facebook. And some other person that is also having suicidal ideas is watching that stream and seeing how that person took their lives. Next thing you know, that person too will also attempt it. So we all need to know how to report these things so that we can protect lives. And is a particular challenge, because how do we regulate it? It's very difficult to regulate. In fact, nowadays, you don't know who is taking your picture. You don't know. I've heard of a case where two girls, roommates, and I think they had a misunderstanding. And one roommate took a nude picture and video of the roommate and posted it to her own boyfriend. And from there, it entered the school social media. You see, I think those things are, those are things that can push people to suicide. So we need to be careful what we do with social media. Next slide, please. I'm soon be rounding off. For health workers, we need to strengthen mental health services. That's very important. And we need to integrate mental health into routine health services, and there has to be specific referral pathways. And for those of us that are mental health specialists, our roles are changing. Before, what we do mostly is clinical service. But now we need to add training of frontline primary healthcare workers to what we're doing. Nigeria today, we have less than 500 psychiatrists practicing in a country with like 240 million people. So which means is almost difficult. In fact, so if you look at 500 psychiatrists, that means like 0.5% of the psychiatrists in Nigeria are actually in this room right now. So you can see how short-staffed it is. So which means we have to work with training other people to do what we're doing. And that's why I've said before, we need champions for mental health. We need primary healthcare workers that can deal with mental health problems. Please, my slides have gone. And so for us as mental health, and then another thing that is important for us to do is to provide that leadership. Sorry, I just a few slides to go. Okay. Yes, and then for healthcare workers, anybody comes to your consulting room, and you know the way some people will say it, they will say it very flippantly about, that look, I actually wish I was dead. Let's take hints. Let's not just brush them off. I was training some primary healthcare workers in Gombe State recently, and one of them was saying that there was a time that he had an opportunity to reach out to somebody, and then just out of the blues, this is a patient that has been coming to the health center for a while. And out of the blues, this person just called him and said, no, I will see you when I come back. By the time he came back, that person had hung himself. So if he had paid attention to listen to the person at that time, that he could have averted that death. So we need to learn to take hints. Up to 90% of people that die by suicide would have spoken to somebody. And most of the time, they speak to their healthcare workers before they kill themselves. Next slide. And for policymakers, we need to do a lot of advocacy. I've said before, we have a lot of beautiful policies and legislation. So we need to advocate for these things to actually be implemented. And then policies have to be dynamic. Years ago, when a lot of our policies were being created, there was no social media, there was no AI. That's another danger now, even though I've not heard any report from here, but there are reports now in several places in developed countries where people, rather than build relationship with other people, develop relationship with chatbots. And in that relationship with chatbots, the chatbots always do something, validate what the person is saying. And there's the parent of a young man now that is suing Meta AI because they looked at their child's chats on Meta AI. And the child was saying, I don't think life is worth living anymore. And AI was saying, yes, I agree with you. And then he went on to say, yes, I think you are better off dead. And I said, yes, that's a very good idea. Until the boy killed himself. So that is another danger of a lot of this media that we're using. They're not yet, the AI bots are not yet very well trained. So they actually are now trained to validate rather than to identify when there's danger. So we need to be careful. Restrict regulations, so social media regulations will be something that will be very important. Budgeting of funds to support implementation of programs and outright bans of some means of suicide or restrictions on the sales. Next slide. And we also need to engage with leaders at all levels, from the community to the government. There has to be that political will and commitment to make a difference, especially with mental health services and with suicide prevention. Funding is very key to successful implementation. Without money, all we're doing is running our mouth. We have to have funds for us to be able to implement. And leaders have to be able to make evidence-informed decisions. So there's need for us to have actual figures. All the figures that we're promoting now are actually based on estimates. So without actual figures, we don't really know whether we're taking any good step towards suicide prevention or not. So there's important for our leaders to take note of this, promote research, promote ongoing monitoring and evaluation of programs and services. Next slide. So in conclusion, suicide prevention requires a multi-sectoral collaborative approach. And we need to engage every stakeholder along the way, starting from us. So we're the number one stakeholder, and then we can now engage other stakeholders along the way. Every one of us can take action at our own level. And one key action you can take, please look out for yourself and look out for others. If we begin to do this, gradually, one step at a time, we can actually stem this tide of youth suicide in Nigeria. Thank you so much for your attention.
A round of applause. You can do better. Thank you very much, Prof, for that insightful one. I understand that some of us might have one. At this juncture, I want to call on the DVC to give us his goodwill message representing the Vice Chancellor of the Osun State University. Put your hands together as we make welcome Professor Adetunji Kehinde. It's a pleasure to have you, sir. Please keep on clapping until he gets here.
Yes, good morning, distinguished participants at this summit. Start by expressing the apology of Mr. Vice Chancellor, Professor Odunayo Clement Adeboye, who is not able to attend physically. The university is preparing for the grand commissioning of the Modupe and Folorunsho Alakija Medical Research and Training Hospital. That's a program coming up on Monday, 15 December 2025, and is a 70 billion donation to this university. You know what that means? A 70 billion, one of the largest in the history of philanthropy to tertiary institutions in Nigeria. So that is why he's not able to attend. And by this, I'm also extending invitation to you to be there on Monday. In any case, we will close down university so that compulsorily you'll be there to celebrate with the university and with ourselves. Yes, want to recognize the organizers of today's program, particularly the founder of the Stillwater Mental Health Foundation, Dr. Oyewole Jr. Thank you for this good work. Let me also recognize the very, very supportive father in the person of Dr. Oyewole Sr. Thank you for giving me this backing, for the mentoring and the kind of training that you have instilled in him. I'd like to recognize and appreciate the keynote speaker, Professor Bibi Lola Oladeji, who just made a very wonderful presentation, cutting across everybody. Everyone has lessons to learn, students, parents, lecturers, policymakers, lessons cutting across everyone. So no one is left out in reducing the burden of suicide in Nigeria. I'm sure you went through or listened attentively to that presentation. One of the resolve that we must take away from here is that we will not add further to the suicide burden of Nigeria. I hope you are making that commitment, that nobody will further add to that suicide burden. By how much are we expected to reduce that by 2030? I want to know who listened. By how many percentage? 15%. So that is the target of the global community, to reduce suicide rate by 15%. Yes, I'd like to put this chart to you. And this is just on the general. Looking at youth, maybe not youth alone. One of the the contributory factors to suicide. One is that we struggle with identity. We struggle with identity. Who are we? Who are you? We struggle so strongly with identity. And my message to you here is that let no one define you. Let no one define you. Do not rely on anybody's opinion of you. Know yourself, and through God, depend on your capabilities and your abilities. Most of the times people tell me what I'm not, and immediately I reject. I tell the person, probably you don't know me too well. I'm not what you are saying. So be bold to reject identities that do not belong to you. Be bold to reject identities that do not belong to you. Yes, everyone goes through stuff, even adults. But let's not, those stuffs, don't let it define you. Every grown-up you meet here started as a youth. We had our challenges. We rose above those challenges, and that is why we are standing here today. So don't be defined by your challenges. Then seek to have victory over yourself, self-control. One of the book of faith that I believe in will say, better a man that has control over himself than a man that takes over a city. That means the virtue that you embody is more important than whatever material possession you can get from through any other means. So then don't be moved. Don't be moved. don't be agitated by material possession. Let your virtues move you around. And I can assure you, since we didn't start the way we are, I mean, since we didn't get to where we are just overnight, you too, you get there. It's a matter of time. Again, youth, we struggle with the question of where we are from. Where we are from. You know, the first one is problem of identity, question of identity. The second one is the question of origin. Where are you from? I can assure you this morning that you are from God. We are all from God. And taking you back to the scripture says we are perfectly and wonderfully made. And what that means is that before you were brought to this world, all that you need for success in this world is already deposited in you. Everything you need for success is deposited in you. And what that means is that you are a finished product. The phone you carry on your hands, I know a lot of you carry the latest iPhone, the latest Samsung, but if I ask you how many of the functions you engage, I'm sure nobody engages up to 40% or 30% of the functions on the phone. What that means is that you as a product, you may not be maximizing the potential that God has put in you. So the challenge to you is to do extra, go beyond the ordinary, and maximize the potential God has created in you. So, having made those two important points, I also know that there are challenges. We have downtimes. There are challenges. No one will run away from that. My advice to you is that when such moments come, please seek help. Seek help. I know in this institution, in terms of financials, apart from the National Education Loan Fund, the NEL Fund, that is available to support your studies, we also have over 300 scholarships in this institution. 300 scholarships awarded by different bodies. We have scholarship for indigent students. That is not so much based on performance. Then you have other scholarships that are performance-based. When you have financial issues, please seek this scholarship. Seek this scholarship. Then again, we have counseling unit on all the campuses. If you need counseling, seek the counselors. At all levels, you also have staff advisors. When you have academic issues, seek your staff advisors. And above all, my encouragement to you, or my charge to you, will be that pursue excellence. That is why you are in this university. And once you pursue excellence, I can tell you that you will make exploits. Once you pursue excellence, there will be no limitations. There will be no boundaries. Some people will say, sometimes back, some people would put premium. Some people put so much premium on maybe social connection alone. But I can tell you, if you are not in a very strong social group at the moment, your academic excellence will take you into any social group. People will want you. So put your mind on academic excellence, and I pray as you go through this path, God will help you stay away from substance, seek help. Thank you so much.
Keep clapping till it gets to his seat. Keep clapping till it gets to his seat. Thank you very much, Professor Adetsuji Kende. And I'll call on the founder, Dr. Oyewole, for an appreciation very quickly. Put your hands together for the founder. Thank you.
TSW. Yes, so thank you very much, sir. We deeply appreciate you. We deeply appreciate the management's commitment to this vision. God bless you, sir. Yes, and I'll be inviting Dr. Oyewole Senior on the stage. Please let's give him a round of applause. Yes. For the presentation of the award to the Vice Chancellor, ably represented by the Deputy Vice Chancellor.
Yes. Thank you. Please, sir, please come forward to receive this award. Yes. This is an award of recognition for your service and commitment towards the Distilled Waters Mental Health Osun Mental Health Summit, presented to the chief host, Professor Odunayo Clement Adegboye, Vice Chancellor, Osun State University, ably represented by the Deputy Vice Chancellor. We, on behalf of the TSW Mental Health Foundation, we deeply appreciate your support, being our host, providing a conducive environment and your role even in the program. We pray that your university will continue to grow in leaps and in bounds. So on behalf of TSW, I present this plaque to you. And I say thank you so much for your support. We look forward to more of your support for our foundation. Thank you, sir.
Thank you very much. A round of applause once again. All right, we continue. At this juncture, I think it's good as well to give one or two to our dear esteemed listeners. You as the audience. Precious, where are you? Please come up. Thank you very much. I just need two persons. You're sure of yourself. You listen attentively when the keynote speaker was delivering her speech. I just need two persons, very quickly. Raise your hand. You want to give me a feedback from what you've learned so far while the keynote speaker was delivering her speech. I need two persons. You don't know what I want to do. If you are confident, just raise your hand very quickly. I need two persons I will call. You got some points and you would like to share. Signify by a raise of hand. Quickly, 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 please. All right, yes, one. Please come out, come out, come out, come out. Thank you. I need one more person. Please appreciate it. Put your hands together for him as he comes out. It's either we have the male gender, we can have, you know, a mixture. I need one more person. A male or a female? Where? Yes, please come, come, come. Thank you very much. Please come now, fast. Thank you very much. Okay. Now, what you're going to do is you would tell just in 1 minute, 2 minutes, share with us what you've learned from what the keynote speaker has said. And then, okay, we have 3. Impressive. Okay, that's 2 against 1. My gender, why now? Why? It's all right. We fire down. All right, we're going to start ladies first, although the guy came out first. But, you know, that's just, they used to say it's a female's world. Even in the number, we have 2 against 1. So I'm going to make it ladies first, then we'll go to the male gender, then we'll take it back to the other lady. Yes. I know you've learned a lot. Just in summary, 1 minute, 2 minutes, you're done. Yes, you have the floor.
Good afternoon, everyone. My name is Precious Moni. During the course of the
Keynote speaker's address.
Of the keynote speaker, what I learned about is the family. She was talking about the family issue, how the family have an impact on the mental health of their kids. So I learned that whatever it is that the parents do, the kids tend to mirror them. So everything the parents do have an impact on the kids, whether they do it consciously or unconsciously. So if the parents are the kind of parents that fight a lot, or they just argue on every little things, it has an effect on the kids, because the kids are affected mentally, and then the only thing they know is that they don't really have more, how can I put it? They don't really have the skills to manage conflicts, because their parents they don't teach them those skills. Instead of them to manage that conflict in a very nice way, they result into arguments and everything. So kids coming from that kind of family does not have any conflict management skills.
Please put your hands together for her. Put your hands together for her. Please give it to the young man there. Give it to the young man first. Yes. Hold on. Come back. Just come. Just stay here. Don't go yet.
Good morning, everyone. My name is Salami Tolulope, yes, from the Department of Nursing Science. And I really learned a lot, yes, a whole lot of things, yes, but just to keep it short, yes, I learned, this is my things, and I learned there's some things I learned that are very, very, ear-opening about how to reduce how to reduce society in Nigeria today. Now, the first thing I learned is to increase mental awareness. I so much appreciate the founder of this organization. I really appreciate the person, and because this is very, very good. This is very, very great, because this program increases the awareness of mental health. It helps us to understand what society means, and help us to reduce the rate. And I believe that if this continues, 2030, as they've said, that the rate of society in Nigeria will be reduced. They'll reduce it to 15%. But I believe that with these things that I've seen, and if it can be portrayed outside, more than 15% of society attempts will be reduced. And again, I learned about students, how students can reduce these society attempts. I learned about building life skills and resilience. I so much appreciate the keynote speaker about speaking on this thing. I'm very grateful, Ma. Then again, public awareness raising. That is very, very a cognizant rate of reducing suicide attempts. I so much appreciate. There are a lot of things I have to say, but just to keep it short, I so much appreciate. I learned a whole lot of things.
Please put your hands together for him. Thank you very much. Thank you. Having life skill, very important. So in case you are here, and I don't want to say much, but you know what to do. It's not just about hearing. It's not just about jotting. It's about doing the needful. Are we together? Thank you. Yes, the last lady there.
Good day, everyone. My name is Oladipo Fata. I learned a lot from this event, though I came late due to the information got to me late. I learned about we should be conversant of the friends we make. They can make you have a low self-esteem. According to Mr. Man, I don't know his name, I'm sorry. He said something about friendship. You have to be confident in yourself.
Okay.
Don't let people's opinion come over you. Become the real you. You can be good and people be saying you're not a good person or something. Mm-hmm. You can feel bad with their words, but don't let that weigh you down. People will say bad to you. They will make you feel less of yourself. But then you have to be confident of yourself. You have to believe in yourself. You have to let them know that you are capable of achieving greatness.
Please put your hands together for her. Thank you very much. It's all right. For the three of you, from the Stillwaters Mental Health Foundation, we have just a token of recharge cards just for you directly. So Precious, we attend to you. Please put your hands together for them once again. All right, to the general public, I have this giveaway recharge card. Glow users, are you here? If you are here, wave your hand. All right. I start. Press the whatever entry code you want to press. I'm doing this first, then we'll continue. After that, we'll do. There are other giveaways to do, but this is the first one I'm doing. All right. Are you ready? 6, 8. You can see it. If you can zoom. All right, let's go. 6, 8, 1, 9, 2. I'm going to do something because some people are smart. The last 5 number is 65182. I go again. The first 5 numbers are 68192. The last 5 numbers are 65182. You are left with what? 1, 2, 3, 4, 5. The 5 middle numbers now. Are you ready? 7, 2, 1, 2. And the last one is 9. Who got it? All right, let's put our hands together for ourselves once again. TSW. The little we do is more. Louder. TSW. The little we do is more. Please appreciate Precious once again. She's my source for this event today. So for every giveaway, once you see her by my side, know that something is about to come up. Please put your hands together once again for yourselves and for Precious as well. All right, at this juncture, we continue, and at this point, we want to all right, before we move on, actually, we'll still have question and answer segment at the end, but in case you have a question for our keynote speaker, I'm just going to give opportunity for 1 or 2 persons to quickly do that now. You have a question, and in case, no, you should not be shy. We are all, intellectuals, so don't tell me you are shy. But in case you still want to, you have the power in writing. That's where your strength lies in. You can write your question. Give it to any of the ushers there. They will send the questions here. So please, 1 or 2 persons. If you have any question you want to clarify before we go to the segment of question and answers fully, can you signify by a raise of hand? You have a question you want to? Yes. Can we have your question?
Thank you very much. Good day, everyone, and good day, Ma. Thank you very much for the lecture. I really enjoyed it. Okay, so my question is, how can high-functioning depression be identified in individuals who appear successful and productive, especially when they themselves don't actually recognize the symptoms? Thank you very much.
Yes, she has noted that down. Yes, there's a lady. Can you stand up? Stand up, please, so that I can see you. Yes, please. Take the mic to her to ask her question. I will give an opportunity to 1 more person so we can accommodate a person more. If you have questions, just be on standby.
Good morning, everyone. So my
Good morning.
question is how to address an elderly person that have gone through how do I put this? That have gone through a kind of trauma. So that person, based on my experience, so I have an elder that went through kidnapping. So she went through kidnapping, and by the time she was released, so she was saying some kind of symptoms like she was ready to die by that time, that they were threatening her. So by the time she came back home, she was really, really traumatized. So my question is, how do I address an elderly person in proper way, please? Thank you.
Thank you very much. I have one more question, ma'am, so that we'll just join the 3 questions together. It's written here, 2 questions in 1. The first one is, how does depression or anxiety contribute to suicidal thoughts? I take that again. How does depression or anxiety contribute to suicidal thoughts? The second, she's giving an illustration. It could be a real thing that happened. If one family member, a close one, died by suicide, and the person is finding it difficult to move on since that death, can the grieving moment lead to depression and then suicidal thoughts? That's the question, ma'am. You have the floor.
I really appreciate these very lovely questions, and it's important that we discuss it. Let me start by saying that if somebody has depression, part of the symptoms of depression is actually suicidal thoughts. So that can actually contribute so much to depression, to suicide. Like, studies have shown that more than 70% of people that either attempt suicide or die by suicide actually had a diagnosable mental health problem, especially depression. So that brings me to the first question of how do we identify depression? Depression is a medical condition, and just like other medical conditions, we identify it based on the kind of symptoms the person and the signs that the person is experiencing. So the symptoms of depression include one of the major symptoms. We call depression a mood disorder. So it's something that affects the person's mood, how the person feels within them. So one of the core symptoms is feeling sad all the time. We can say low mood. So the person just feels sad. You cannot lay the finger on, this is what is making me feel sad. And there's nothing the person does that can actually lift the mood. So the person feels sad all the time. And along with feeling sad all the time, other symptoms can include feeling tired all the time, what we will refer to as low energy. Another important symptom is losing interest. There are things that normally the person loves to do, and then the person will just not feel interested in doing them anymore. And there's some people that ordinarily you know them, they're always well dressed, well groomed. When they develop these symptoms of depression, they just lose interest in doing anything, then they appear shabby and drab. Other symptoms include things like low self-esteem. So even though I mentioned low self as one of the precursors of suicide, it's also a symptom of depression. Having low self-esteem, having feelings of worthlessness, not having worth in oneself is a symptom of depression. Then some people with depression can be having, in addition to these things, vague symptoms all over their body. They just feel weak. They have pains all over that they cannot explain. It's as if things are moving around their body. They just can't explain, all the things that are happening. And some people with depression begin to feel hopeless. They have bleak view of their future. They don't see anything good in the future anymore. That's what some people describe it, that when somebody has depression, it's like putting on a very dark shade. When you put on a very dark shade, what do you see? Everything becomes gloomy. Everything becomes dark. So for us to say somebody has depression, I've reeled off several symptoms. The person must have 4 symptoms, including at least one of the 3 that I initially mentioned, which is low mood, losing interest, or low energy. In addition, with 2 or more of the other symptoms. If somebody has that, and these symptoms is affecting the person's ability to function day to day. When you feel like that, you are not interested in doing things, the person may stop going to class. The person may stop taking good care of their appearance. The person may become withdrawn, not so interacting with other people. So when you can identify the symptoms, and then it's affecting the person's ability to function, and then those symptoms have been there for at least 2 weeks or more, that's when we say the person has depression. Are you following me? So we base it on that, the way, we ask questions from the person about how you feel, and then all these other symptoms. And if we can identify about at least 4 or 5 of those symptoms going on for more than 2 weeks, and affected the person's ability to function, then we say the person has depression. So that's how we diagnose it. So if you've been experiencing such symptoms, please don't hesitate to seek help. Depression is one of the most easy to treat conditions. And if you can treat depression well, it improves the person's quality of life, because having depression imposes a lot of suffering. I've seen people before, and because of our cultural context, a lot of people don't want to take drugs. I remember a daughter of a colleague, when her mom brought her to me, one of the things, it took me weeks, months before I could convince her to take treatment. And this was a very brilliant young lady, and it was affecting her studies. Because of the symptoms she was having, her grades were going down. But because of our cultural context, they think, no, nobody wants to be on treatment for a mental, I don't want to be labeled the psycho, as they say. But it's not like that. So please seek help. When she started taking the treatment, within a few weeks, she got herself back. So please, it's needless suffering when somebody has of depression that is not being taken care of. In terms of the person that was kidnapped, those kind of events can be very traumatic, and it can affect literally anybody. It can actually produce a total change in the person's personality. It can precipitate any mental health problems. It can precipitate depression that we have discussed. It can precipitate anxiety. It can precipitate post-traumatic stress disorder. It can actually even precipitate even more serious mental health problems. My counsel will be, if it's possible, encourage that person, maybe get somebody older than you that can also chip in, that you raise the awareness of somebody than you. Then the two of you can now work together to get that person to treatment. It is not in every case that we have to use medications to treat. It might just be counseling that the person needs to get better. So that's very important. So the person needs to seek professional mental health care from a psychiatrist. I know there are many psychiatrists. I have a lot of colleagues that work here. If the person is there in Oshogbo, we have colleagues that work literally anywhere. I'm sure through the still waters, no matter what state in Nigeria that person is, through the still waters, you can actually get contact of a psychiatrist that can attend to the person. That person needs mental health because, as you said, it can actually precipitate suicide, and it's better to save a life. Getting that treatment timely can actually save a life. I've answered the first of these questions. Like I mentioned during my presentation, when somebody has a family member that has taken their own life by suicide, the person also is at risk for suicide. One of that is important, just like I answered the last question, witnessing or hearing about a close family member dying by suicide is a major stress. And when we have been stressed like that, or a major trauma, if you know that maybe somebody has a wound on the body, when that wound heals, what happens? It will leave a scar. The same thing happens. Thank you. The same thing happens when we're exposed to emotional trauma. Emotional trauma is also a wound, and it can leave a scar. And sometimes that, even though if the person does not seek help, in fact, it will not even heal, talk less of leaving a scar. So with emotional trauma, we should treat it like somebody that has a wound. The wound needs to be treated. And the way we treat that wound is to seek professional help. Please seek care. If you know that person, please encourage the person to seek professional care. Thank you.
A round of applause to our keynote speaker. All right, ma'am, permit me, I would like you to accommodate more questions at this time. We have a lot of questions. However, I'm going to read one here. I just hope we'll be able to cover as much as possible. Before I allow the audience to ask questions directly, I have this one here. All right. You've partially answered this, but I'll still ask, what are the hidden signs someone might be suicidal, even if they seem fine outwardly? And how can we respond without making them feel judged? That's one. I have this other question here that says...
It's good they are written, so you pass them so I can...
All right.
to
Please
help
help me with this, Ife. Thank you. This one I have, how can you talk to someone rather about a particular mental illness you have without feeling like a burden to them? And the last one for this segment, before we continue, is this. It has been confirmed that different particular thinking pattern are mental disorder, and I have both of the thinking patterns. What do I do?
That one is a difficult question to answer because I'm not sure what the thinking patterns are. Okay. But I'll come to it. But let me answer the first one. Hidden signs that somebody might be suicidal, even though they seem fine outwardly. I've mentioned it before. The person might be dropping hints. Don't worry. Very soon, all of you will be free of me. That's a hint that you should take. Or the person might be, there's some people that I know who silently start distributing their stuff. When I'm gone, you can take this. When I'm gone, this belongs to you. And some people take unnecessary risks. You know, particularly somebody that knows how to drive. and is driving along the road inside the school at 120 kilometers per hour, taking unnecessary risk is part of the silent signs that somebody might be might be wanting to commit suicide, kill themselves by suicide. We're trying to not use commit, that is a legal term. The thing that one can do, how you can respond to it, as I've said, please befriend the person. Be a friend to that person. Let the person be able to you and voice out how they feel within them. And I mentioned during my talk, I think I should say it again, asking somebody directly about it will not make them more likely to kill themselves. It will make you to understand what the person is going through and how you can help. But there's a way you can ask. You can't go and ask somebody and say, if I turn to Dr. Wele and say, Dr. Wele, do you want to kill yourself? What will he tell me? Of course, he will say no. Okay, so the way we usually approach it, we approach it in a stepwise manner. I've noticed of recent you've not been feeling too good. Do you want to tell me about it? And the person say, no, I don't. Say, okay. You can also go ahead and ask the person that, how do you see your future? You understand? Because people that have that suicidal thoughts are hopeless. They don't see anything good in the future. So that is one way to start. And to ask, have you been having thoughts of death? You understand? See that I've not asked directly, do you want to die or do you want to kill yourself? So you can ask about thoughts of death. And if the person says yes, then you can take it a step further. Have you been thinking of killing yourself? So you see that don't start with that one. You know, that's one thing. If the person says yes to that, then you cannot ask, have you made any plans? In what way do you think you want to end it? If somebody tells you how they want to end it, please know that that person is really serious about it. So, and the person needs help. So what you need to do, please link that person with professional help, because it will weigh on your heart if after the person spoke to you, the person now dies by suicide. You know, for a long time you'll be thinking that I wish I had taken this step, and it can make someone feel guilty. Then this person says, how can you talk to someone about a particular mental illness you have without feeling like a burden to them? Sometimes this can be tough, but it depends on who the person is. If it's somebody that is your close friend, and it's somebody, you know, that really loves you, they don't feel burdened. You are not a burden to them because they are there for you. So it's important to know who you are talking to. And because it's when you talk to people that have understanding that you can be helped. If you are talking to people that will tell you, is it only you? Just snap out of it. That is not helpful, because you cannot snap out. It's not something that you can help yourself with. So it depends on who you are talking to and where you are seeking help. So the first thing that we need to hammer, please let us all get informed. If we are informed, then we will not see somebody that is passing through an illness as a burden, because we understand that this is what that person is passing through, illness. And when somebody has an illness, what do? We treat it. So we should help the person to seek help. And somebody said that it has been confirmed that different particular thinking patterns are a mental illness, and I have both of the thinking patterns. What do I do? The problem I have is there are several mental health problems, and thinking depends on the mental illness. So it depends on what kind of thinking pattern this person has that will make me know this is the actual illness that we want to deal with. What I will suggest to this person is, please don't be shy. Seek professional help. If you seek help and somebody talks to you, they will be able to diagnose whether you have a mental health problem or not. And as I tell people, it is not every mental health condition that we treat with medications. There's some that all we need to do is some form of talk therapy, and the person will get well. So some people are afraid of the medication. Some will ask me, Doctor, I think medications will be addictive. Medications are no more addictive. Mental health problems are similar to, we call them, they are a part of the non-communicable diseases. And what we mean by that, these are diseases that cannot spread from one person to another. So these are diseases that, you know, it's not malaria, where mosquito bites me, mosquito bites gets malaria. They're not like that. Things like hypertension and diabetes these are illnesses that what we can do to control the symptoms. So that is why it's important to seek help. The symptoms can be controlled either with drugs or with other forms of intervention that can be, just the talk therapies that we do. So that is very important for us to understand. So please don't be shy to seek help. Help is always available. And for us, as I always tell those that are close to me, there's nothing you talk to me that will make me see you as a burden, especially if I know this is what you are dealing with. So please don't be shy. We as professionals don't see anybody as a burden. So these are things that can easily be taken care of. Thank you. I don't know if Dr. Wally wants to add anything to it.
Thank you. Please, a round of applause to our keynote speaker. All right, I want to entertain questions from the audience, 1 or 2 persons to ask questions as we wrap up this segment. Okay, all right. The lady, all right, let me give it, all right, the lady in glasses, please.
Good day, everyone. First of all, I would like to say it was very bad of me not to say thank you very much for the opportunity for the prayer. It was really bad of me. So my question is, my younger sister, she's 10. She has been talking about killing herself. And there was a time where I was in the kitchen with her and she was moving funny with knife, and I just had to take you from her and send her to her room. So I want to ask, how can I help her? Because I've tried talking to her, because she has been telling my parents that she wants to die, things like that. She's tired and things like that. So how can I help her in that sense? Thank you very much.
Thank you. Because the thing with that is she's seen that thing modeled somewhere. So what is she watching? No, I don't want her to answer the question. I'm just saying it so that you know, because listen, let me tell you a real life case that we've handled before. I can't even say we handled it, because it was after the fact that the mom came. 2 children were in the house, and I think the older one should be about 8 or thereabout at that time, less than 10, I'm sure. And then the younger one, maybe 2 years younger. And then the 2 of them were in the house, and the older one did something, and the younger one said, when mommy comes back, I will tell. And then the older one goes, you will tell mommy? He said, yes, I will tell mommy. You will tell mommy? Yes, I will tell mommy. Then I will kill myself. And this child went and got a rope and actually hung himself. And the mom came back to meet the dead body. And they've been watching African Magic. So they've seen the procedure done. So please, you need to look into, number one, I would counsel that the family should take her to a child psychiatrist that can deal with it, so that they can actually know what the underlying problem is. Number 2, we need to look at what is she watching, what is being modeled to her, because a lot of these cartoons now, there's so many things going on, a lot of movies, there's so many things going on in a lot of that are not helpful. So that is very important. Please.
Thank you very much, Ma. The best way to say thank you is to say thank you. Apologies, we have lots and lots of questions. We might not be able to entertain them now, but as time goes on before we wrap up, we might still be able to entertain 1 or 2 more questions. Put your hands together once again as we make welcome the founder of the Stillwaters Mental Health Foundation, as we appreciate our keynote speaker. Thank you very much.
Give another round of applause. On behalf of the Stillwaters Mental Health Foundation, we would like to say a very big thank you to Professor Bibi Lola Oladeji. Let's give her a round of applause. Yes, but I'm too small to do that in person. So I'll be inviting Dr. Deborah Onisile to do the honors on behalf of the foundation. Please, let's keep clapping.
Okay, before this is done, can we all say thank you, ma? Seriously, I'm sure we have all learned, and this lecture is really an eye-opener. And then, after this order, we want to give this, I present this award to Professor Bibi Lola Oladeji on behalf of the Still Waters. Thank you very much for all you do. Thank you for your contribution. Thank you very much, ma'am.
All right. Attention, please. As all of us are here, I believe you have been given a questionnaire to fill. I want to call on the research lead now for an information. Please put your hands together for him as he comes up.
Hello, everyone. Okay, so thank you very much. The questionnaires you received, I need you to follow some specific instructions. We've observed that some people submitted, but they've not filled every single question. So I'd like you to cross-check, go through your questionnaire, make sure that every box is filled. If there's somewhere you don't want to answer, there's a spot where you can fill in, prefer not to say. If there's something you're not sure of, you can fill no there. Understand now? If there's something you don't want to answer, you can fill no there. If there's something you want to answer, fill yes there. We've made it simplified just to tick. All right, so please cross-check and ensure that every single question are filled, especially the question at the back page, the cage questionnaire. Please help us fill it up. So take 1 minute to quickly do that. Then I'll give instructions on how to submit and pass your questions so that it won't be rowdy. All right? Please, can I have the LOC members immediately after the photo shoot to get ready to collect it? Yeah, go on.
All right, thank you very much. So please kindly get to do that. The boxes you've not filled up, do them. And be very, very sincere with your answers. As I believe it's written there, whatever you've written is confidential, isn't it? Research lead, it's confidential. Please, so don't worry, your information is kept confidential, and please just sincerely help out with this. Thank you very much once again. All right, at this juncture, Precious, come over, let's do something. Who is ready? TSW. The little we do is more. TSW. Give me another network provider. Don't give me the one you gave me earlier. Give me another one. Everywhere you go. What network is that? Thank you very much. All right, enter your entry code. Have you done that? Let me help you. Put the hash at the end already. Have you done that? Have you done that? Let's go. First 4 digits, 5656. I take that again, 5656. Last 5 digits, 04014. 04014. Now, the next digits after the first 4. Now, continue. 7568. 7568. The last 4 digits now. 4063. Give me another one, Precious. Who got it? All right, that's good. Congratulations. Give me another one. Give me another. Anyone this time. I'm actually doing 3 now. So this is the first. The second now. This one is, there was a time they were making life better. What network is that? Thank you very much. Is that what they are till now? What's their new slogan? I don't know, actually. All right, let's go. Okay, I want to know so that I'll not just be calling things. If you are using Airtel here, wave your hand. Okay, we have people. Let's go then. 0157. I'm going to call this one straight. I'm not going to change. 0157. I continue. 9053. 4718. The last 4 digits now. 5008. Who got it? Somebody said chai. All right, the last one for now is this. This is Glow. What's Glow's slogan again? What's their motto? Okay, Grandmasters of Data. It's all right. It's just that when you sub on them, sometimes you just see the network will disappear. I'm not against any network. Anyone? Okay, it's like me. I'm turning it. This thing is turning on your own. All right, last 5 digits. The last 5 first. 393. Sorry, I take that again. 39690. The last 5 is 39690. Now, starting from the first. 68824. 68824. 6402. The last one before the last that I called is 8. Who got it? Nobody said this time. What happened? Yes, who got it? All right, that's good. Congratulations. Once again, put your hands together for yourself as we continue with the other aspects of the program. At this juncture, we want to have a panel discussion. However, at this point, if you are done filling the questionnaire, please, the LOC committee, kindly help in collecting the questionnaires now. Let's do that. Thank you.
All right, thank you, everyone. So I assume that we've all filled every question. So this is the instruction now. The LOC members are going to be collecting it from the midline here. So I need you guys, if you are too far from the mid, just pass it to the nearest person and on towards the midline. So the people at the midline will give it to the LOC members easily and directly. So it doesn't have to be rowdy. So let's pass it like that. If you're here, pass it this way. If you're over there, pass it this way. All right. So while we're waiting for the panelist session, let's make that quick. LOCs too, when you check it, please be sure that everything is well filled, all right? Okay. Please. Let's not forget those in the gallery too. Please, if you're in the gallery and you have the questionnaire and you filled it, please, there should be at least an LOC member over there. So make sure you fill it and submit to the person. All right, please make sure it's well filled and submit. Doesn't have to be rowdy, so gently. All right, if you still have your questionnaire with you, please raise up your hand. Let's be sure. If your questionnaire is still with you, please raise up your hand. All right. Gallery, what about you? Is your questionnaire still with you? Okay, please, LOC, we need someone in the gallery, both galleries. Please, there are questionnaires there. Well done. All right, thank you very much.
Thank you very, very much for that. All right, at this juncture, we want to go to the panel discussion. And we have our panelists right here with us this morning to be handling the segment. Seated on the high table, first to recognize is no other person, Dr. Adeoye Oyewole. It's a pleasure to have you here, sir. Thank you very much for coming. Also on the high table, I've got representing the students here, Ife Gospower, right here with us. Thank you very much. Thank you. Also to handle this panel session is Dr. Onishile Deborah Foluke. It's a pleasure to have you here, ma'am. And I'm going to take the citation of each one of them. Yeah. All right, while we are setting up for the panelists, I want to sincerely recognize all students from the various secondary schools we have here. From the list, I have Nuruddin Grammar School. If you're here, wave your hands. Let me see you. Put your hands together for yourself. Nuruddin Grammar School. Thank you very much for coming. Also, we have, the two, we have Nuruddin Grammar School, and it's a pleasure to have you here. And I want to call on the Vice Principal of Nuruddin Grammar School to please come to the high table in person of Bami, is it Mr. or Mrs.? Mrs. Bamidele Folashade. Just wherever you are, ma'am, please come to the high table. Thank you very much for coming. And also the teacher who has accompanied them to be here this morning is no other person. Sorry, this afternoon. We're in the afternoon already. Is in person of Mr. Olaya. Olaya Tyro. Please, wherever you are, sir, please. Your students are even excited. Impressive. Madam Principal, you're welcome, ma'am. Thank you very much for coming. Mr. Olaya Tyro, thank you very much. All right, welcoming to the stage for the panel session, I want to first of all call on Dr. Beg your pardon, Dr. Adeoye Oyewole. Please, sir, you can come up for the panel session here. Please put your hands together for Dr. Oyewole Senior. Please applaud. Put your hands together. Thank you very much. Before I read their citation, I'm going to invite them first to the panel seat, and then I'll take their citation. Also, I want to call on Dr. Onishile Deborah Foluke. You're welcome, ma'am. Please, if you want to clap, clap very well. And I did say, what is what's doing? Is what's doing well. So if you want to do it very well. And also, I want to call on Ife God's Power. Let's come and take his seat. All right. Yeah, sitting before you, I would like to take the citation of Dr. Oyewole Adeoye. Sir, please, can you rise as I take your citation? Dr. Adeoye Oyewole is a distinguished psychiatrist, life coach, and mental health advocate whose multidisciplinary expertise spans theology, anthropology, and behavioral sciences. As the leader of Life Care Consult, he champions holistic human development, offering consultancy in mental health drug rehabilitation, HR management, and organizational behavior. Renowned for his workshops on executive stress, burnout, and mental capital development, Dr. Oyewole emphasizes the link between mental well-being and productivity. A respected media figure, he hosts issues in Christendom on Rave 91.7 FM and has written over 300 articles for the Punch newspapers exploring themes of societal development, mental health, and leadership. Thank you very much. His book, Eternal Life, Healing for our greed reflects his deep commitment to addressing behavioral issues through a hybrid of theological and mental health lens. Dr. Oyewole is widely recognized for his contributions as he holds fellowships and memberships in prestigious bodies, including the Chartered Institute of Personal Management, the West African College of Psychiatrists, and the Nigerian Medical Association. If you want to clap, clap. He is also a fellow of the Chartered Institute of Corporate Monitoring and Coaching, NHREA. His cross-disciplinary work continues to mark a significant impact on individuals, organizations, and broader society. He is also a distinguished academician, an associate professor of psychiatry. If you are clapping, clap very well. Currently, head of Department of Psychiatry, Lautech, Ogbomosho, with over 40 publications in international and local peer-reviewed journals. A trained Baptist pastor, married with 3 lovely children. Ladies and gentlemen, I present to you Dr. Adeoye Oyewole. It's a pleasure to have you here, sir. Thank you very much. Also, I would like to read a citation of Dr. Onishile Deborah Foluke. Thank you very much, ma'am. Renowned mental health specialist, registered nurse, and academic leader, Dr. Onishile Deborah Foluke is a distinguished mental health expert, registered nurse, and academic leader with a strong passion for promoting adolescent mental health. With over 14 years of experience in academia and healthcare, she has established herself as a highly respected professional and scholar. As a mental health specialist, Dr. Onishile has demonstrated a deep commitment to supporting the mental well-being of students, particularly adolescents. Her roles have included providing counseling services, conducting research, and developing evidence-based interventions to promote mental health awareness and reduce stigma. Dr. Onishile's academic credentials include a bachelor's degree, 2 master's degrees, and a doctorate in mental health psychology. Thank you very much for that. She is a member of prestigious professional bodies, including the American Psychological Association, Sigma Theta Tau International Society, and the American Heart Association. Additionally, she is a member of the Mental Health Foundation, Gambia. She serves as an external examiner for the Nursing and Midwifery Council of Nigeria and has served as the head department of Nursing Sciences at Redeemers University and holds various leadership positions within the institution. With an impressive portfolio of 42 academic publications and 37 research studies completed, Dr. Onishile is a renowned expert in her field. Her passion for promoting mental health awareness and reducing stigma has inspired countless students, and her dedication to supporting adolescent mental health has made a lasting impact on the lives of many. A devoted wife and mother, Dr. Onishile is happily married with children who are her greatest joy. She is also a proud academic mother to many, having mentored and supervised numerous students and young professionals in the field of mental health. Ladies and gentlemen, I present to you Dr. Onishile Deborah Foluke. Thank you very much. It's a pleasure to have you. And lastly, I want to present to you no other person than Ife God's power. Put your hands together for him. Ife God's power is a rapidly emerging thought leader at the intersection of self-actualization, healthcare, business, and development. He believes the marketplace, life, only rewards the top 1%, and he lives by that standard daily. His philosophy is simple yet profound. Find the line of expectations and exceed it in grand style. Having experienced the highs and lows of the Nigerian system firsthand, Ife Gospower deeply understands the frustrations of young dreamers and students trying to find their place in a dysfunctional system. The pressure to perform, the confusion about identity, the quiet battles with burnout, fear, and self-doubt. These experiences fuel his commitment to helping students develop inner strength and grit, healthy coping mechanism, and a purpose-centered life. In 2024, Ife served with the Stillwater's Mental Health Foundation, Osun, where he played a defining role in strengthening student leadership and development. Notably, he consecutively convened e-quotation session in 2024 and 2025, reaching over 800 students and participants in the College of Health Sciences, Osun State University, giving them a head start, practical guidance, and support to ease the transition into the demands of university life. He is building a generation of world-class professionals and polymaths with the mindset and skill set needed to disrupt the redefined global system by imparting in them real-world knowledge on how the world truly works, what genuine success actually demands, and how to rise with purpose rather than the half-truth and sweet nothing common today. Today, he wears many hats. Do you want to hear that? TEDx and keynote speaker, life coach, an advocate for healthy, holistic living, and a fourth-year medical radiography student. At the core of his work is a genuine commitment to see young people thrive and to embody excellence. Ladies and gentlemen, I present to you Ife God's power. Thank you very much. All right, before we go to the panel session properly, I would like to recognize students representatives here from the College of Education, Ikpetu Ijesha. I appreciate your presence. Please, if you are here, wave your hands. Student representative, thank you very much for coming. We really appreciate your presence here. All right, moving to the panel session at this moment. Thank you very much. I am going to start with, please, I would like the mic to be given to them. Just give it to them. All right, once again, I want everyone to this panel session, and we're going to have a wonderful time. Please, I want you, just as you paid attention during the first segment, I would like you also to do that. And in this session, we shall be looking at the role, just as you can see behind there. We are looking at the role of peer support in combating drug addiction. That will be the center of our conversation in this session. And I'd like to start with Dr. Oyewole. Explain to us, first of all, the concept of peer pressure, how it differs from the aspect of family support. What is the thin line or the broad line between peer pressure and family support? Yes, sir.
Yeah, thank you, moderator. Let me shock our young people. I want to shock our young people. All of us. Yes, Dr. Mrs. Oduyebo is here.
All right, ladies and gentlemen, put your hands together. Just let's have a straight up to Mrs. Oduyebo. It's a pleasure to have you here, ma'am.
She must have been beat.
It's a pleasure to have
to
you all.
rush her.
Please put your hands together for her once again as she steps forward.
Thank you, ma. God bless you, ma. Yes, she's a consultant psychologist and a lecturer here, I guess. University? Okay. Maybe you just introduce yourself. Sorry.
I'm Dr. Adiola Oduyebo. I'm a consultant psychiatrist at Osun Teaching Hospital. And I do some other things. Yes, I'm a pastor. I also pastor a church in Malaysia. And we also have an NGO, Destiny Development Initiative, that helps in doing a number of things, which includes young people, the orphans, the vulnerable, education as far as the Osun State is concerned, and much more. Thank you.
Please, if you want to clap, clap very well. What is
Sorry.
what doing is what doing well. Thank you very much. Now we go fully to the conversation proper. Yes. Dr. Oyewole, yes. The difference, the thin line. Okay. All right, at this juncture, we are looking at the role of peer support in combating drug addiction. And that is what we are focusing our centering on. And we're also going to involve the aspect of, suicide and all as the conversation continues. So now we're talking about the first aspect of the difference, the thin line or the broad line between peer pressure and family support.
Yes, let me start by saying that I don't believe that it is young people alone that have peer pressure. And I want to bust that myth. Your parents have peer pressure. I remember when I was young, when my children were a little younger, when I would carry them to school. Consciously or unconsciously, they were comparing my cars to those of other parents. When it is time for birthday celebration, they were comparing how grand some people's birthdays were compared to mine. Is that not some pressure on me? Hello? So peer pressure is not just limited to you young people, and you need to understand it. Your parents are under some pressure from their peers for sending you to school. And because they are bringing you to school, they have had to do away with certain things that also put them under pressure. Now, for young people, it becomes more profound because you have not learned how to develop your own sense of self. So every human being is under some form of peer pressure. But for young people, peer pressure becomes profound because your identity is diffuse, is lost in the social mirror. So whatever the social mirror tells you has become law. And that also diminishes the family support. You lose the support and the counsel of your family, which is your primary agent of socialization, because you have not developed yourself. So you feel what the other people are telling you is more correct than what your parents are telling you. So we are elderly. I know that I have defined my life this way. I choose to educate my children. I don't have money to buy a new car, but I can still justify the reason and be happy with life. So a lot of you young people don't have that. And so peer pressure becomes very profound and dangerous. And what they do is to lure you into their own destructive patterns. Thank you.
Thank you very much, sir. Please applaud to Dr. Oyewole. Ma'am, I would like to ask this question. Whenever we make mention of peer pressure, we always see it on the negative. Is there a positive side to peer pressure?
Thank you. Good morning once again, everyone. I hope you're fine. How are you today? On a scale of 10, how fine are you? Someone said 10 over 10. 5, 2, 3, 8, 1. Okay, good. I know why I had to delve into that. But I know that if I tend into it and ask why we have 2 over 10, some of you will go towards the direction that we may all not be able to address here at the moment. However, that's just on the lighter note. Now, I want to talk about peer pressure. You know, when the word comes, we look at it in the negative way. However, it's not. You know, Daddy just mentioned something now. Sorry, I'm an African. And then just said something about the younger ones not being alone in the heat of peer pressure, that it's across all levels. However, it's like saying, let me put it after the order of anxiety. It's like talking about anxiety. When we say anxiety is not good, however, mild anxiety helps you to prepare ahead of things. And that's where the word peer pressure comes in. So as to say whether it's a negative, it's just seen as a negative word, no, it's a no. There's a positive side of it, where you get to see things. It puts you know, the pressure from your peers puts you on your feet. You get to be on your toes. Like you see someone that is neat, always neatly dressed, you know, speaks well, and then you want to brush it up. You're not seeing it on the negative side as to, oh, I'm bad. She speaks well. I can speak well. But then you want to polish yourself along that side. So that's the aspect, that's the positive side, you know, an example of the positive side of peer pressure. So I would say that it's not just a negative word, phrase, it adds the positive side to it.
Thank you very much. Still on you, ma'am. That means, are you in that concept, can we say someone like an accountability partner, it's a positive side of having somebody giving you like a peer pressure positive side? Yes. Or can we have examples of peer pressure on the positive side, please?
Okay. Now, let me start by saying, you know, let's define the word peer pressure.
Okay.
Now, when we say peer, we look at it vis-a-vis someone around the same age range with you. It's not limited to a particular age group. When they say age range, your colleague at work, your partner. However, not saying whether an accountability partner is a peer influence. Yes, it is. And giving an example, let me give an example of myself. I grew up, I started as a young girl with a lot of dreams. You know, dreams that I myself could not fathom. I don't know how to unveil it. You know, this dream of becoming a minister of health, becoming the president, you know, that dream. And then I didn't grow up like some of you grew up with educated parents. You know, I envy you now, seeing daddy being educated. And then some of us didn't. I had my first degree before my daddy. I think my daddy went back to school because, you know, all of us had to challenge him, and he went back, came back with his first class. Now, this is it. I didn't grow up with that. However, let me just delve in. I had my first degree, you know, at OAU, where it was really bad, very, very terrible. CGPA, I cannot tell you what it is. But then I wanted medicine. Then I had nursing. However, it was not just nursing. It was something that has to do with impacting life beyond just the regular give drugs, give medication and the likes. I knew I wanted more. And then when we were leaving school, when others were talking about career prospect and all that, people were counting, okay, 3 years, CNO, NS. I was looking at my friends like, who wants to go towards a DNSP career? And, you know, all of this, I was just wondering, and each time they are talking about it in class, you know, amongst my friends, then I go and like, this is not that way. It's not my path. But then my path, how do I actualize it? You know, there's a whole lot. And then I left school. I knew I would not spend max 5 to 7 years at the bedside. By how I would, the next way, I don't know. How, I don't know. But I know I would forge ahead in my academics, even though I never liked academics because of the stormy and the, you know, the pathway that didn't go so well. But then, and then it not happened that after school, I met this friend that is now my husband. And all of a sudden, he comes to the house while I was working at his bedside. During my off days, he's wondering, why are you sleeping? Why are you watching movie? And I'll be like, I have my off days, I need to rest. And then he goes, what do you like doing? And I'm like, I like cooking. I like to see events go on well. And that's where we started from. Started from there. The next day, the next week, he went to get me a form to go and start learning how catering and all that. I started that. He would take me there before he goes to work. Come back, pick me up. If I have duties, he will come and try to say, Jack Robinson, yeah, start making cakes. You know, give it as a gift. Let people know what you're doing. You know, it started that way. I thought that was where we're going to end. And then, alas, I had my first baby. During the mat leave, he came back and said, come. So you're going to spend these 3 months at home? And I was like, what is wrong with you? We are still doing cake. He said, no. Oh, yeah, let's check. Where can you do PGD or MSc, anything? You need to do something. You can't just be sleeping here. Trust me, that man is an accountability partner. When I did PGD, because I had to go into psychology, I started with clinical psychologists, and said, see, if you're going to do this, you do it well. You must know it. And so it comes like, so when I joined the academics again, just to cut it short, he will tell you, no, you're not becoming the regular lecturer. So in this house, what I know is academicians, they don't sleep. So if you are sleeping too much. I'm like, what exactly is the problem? So this is just yes, a peer pressure is my husband, but then the pressure at times I just like, hey, this man, please, would you just leave me? And then, but then the positive side is what we are all seeing right now.
Thank you very much. So initially, I want to go to Dr. Oduyebo. We've established the fact and we understand the concept of peer pressure. And we understand it could be on the positive side and it could also be on the negative side. However, the second aspect of this conversation is drug addiction. A lot of persons, when they hear drug addiction, what comes are those hard drugs. Can you explain the concept of drug addiction? Let's establish the foundation first before we go into the conversation.
Okay, thank you so much. It's important that we understand what drug addiction is and what we call drug dependence. And many times when people say, in fact, in an efficacious way, especially leaders say, well, you're just addicted to it. I'm addicted to this. I'm addicted to this. When you understand that addiction is a disease, you will run away from it. And specifically, drugs. There are different types of drugs that are problems. Alcohol is a drug. Many times, some think that all I just take is alcohol. I don't take any other thing. You know, alcohol. We have cannabis, what we call igbo, marijuana. And you know, that has come in different forms. You have skunk, you have ganja, you have kolos. You know, I jokingly say that you took kolo. You can see the word is kolo. So you understand that it may turn you the other way, you know. And also loud, Arizona, they call it Milo, they call it Caprisone. You know, all kinds of names to hide what really it is. But you know, it is still something of cannabis and something that gets over it. Then you know, the cough syrup that used to be in all our pharmacy stores, and it's whenever people have cough. That was safe. People have found out that there's an ingredient in that thing that can make you become euphoric, and for that reason they get into the use of opioids. We've had people who, aside from, especially people who have pain and probably introduced to some injections at a time, especially people, patients that have sickle cell disease, they start injecting themselves, you know. We've had admissions of people. There was a person we had to admit one time who had injected himself so much. By the time he came, his hands were like this. He couldn't even take his bath or put it back. And then, you know, with all the contractures and all that, staying on the word, he said he was taking alcohol, and somebody told him there's something, if you just take this one, oh, you will not look for alcohol all your life. So he came cursing the person, could need that from like, yeah. But you know, as of that time, he had the problem. On the word, we had to call the orthopedics people, we had to call the plastic surgeons who came and told him he had to straighten one with more than 500,000. To straighten the second one was more than 5. And even the straightening was dear straightening. I hope you understand that English. Dear straightening, you know. And so by the time they did it the first time, this is where they got to, and the pain was terrible. I began to say, well, later, initiate the second one more. The hands at the second one is still like it because of the pain he had to go through. So you have that, you know, and then you have some other types, the cigarette smoking that people think, since it's licit, because when we talk about different substances, we talk about the illicit, which is the legal, and the illegal. And so many times people say, okay, this cigarette is there, it's also a drug. And others, tramadol, and many more. Some go as far as one they call the new psychoactive substance. They mix urine with lizard and all kind of things, and you know, some sniff gutter, you know, and all kinds of things. So many innovations have come just to make people feel high. But once you find out that you are in that and you cannot stop it, and you found out that it's becoming the more important thing as far as your life is concerned than any other source of pleasure, you prefer it to watching a film, you prefer it to anything you used to enjoy. Or when you find out that you get to a point of taking it and you are beginning to lose control, or you know that this thing is going to harm me and you continue, then you can be said to be addicted. And you know, the problem with addiction is that when it gets in, it's taking over. It's reformatted your brain in such a way that you cannot but go for it. And that's where the problem is. And that's what drug addiction is concerned. You know, I just want to say this, because I don't know whether there'll be an opportunity to say that even after now. You know, there are new drugs, there are new normal drinks, which I'm not saying you should stop. But you know, you find out that you liking Predator, you like Fearless, you know, and much more. You can call more names than I have even done. You know, you should be careful. Those substances have coffee, and coffee in very high amounts that tips some people to some of these other drugs. Aside from the fact that if you find out that you take coffee and you cannot stay, it's also
One, two. Thank you very much. Thank you very much for that. All right, I want to, now that we have established the aspect of peer pressure, I've laid a foundation for, you know, drug addiction. I would like, from the student angle, you're a student leader and you're also a student. In your own opinion, what would you say is the cause for why students get addicted to drugs? We need to know the reason before we now provide a solution to that. Let's have that.
Okay, good afternoon, everyone. Firstly, allow me to take this moment to thank the organizers and the foundation that's, you know, put up this great initiative. I'd love to say thank you to the Still Waters Mental Health Foundation for organizing and for creating a space, for creating a convivium where we can talk about issues relating to this. I'm saying thank you to the Stillwater's Mental Health Foundation, and specifically, I'd love to say thank you to the spearhead of the whole initiative, the spearhead of the vision of curbing and making life better for youth, making life better, our mental health, making it holistically sound. Ladies and gentlemen, I'd love to say thank you to Dr. Oyewole, the spearhead of the whole foundation. Thank you so much. Thank you so much. So, for your question, I'd love to take it from this light. I would say there are tons of reasons why people resort, why students specifically, why they resort to taking drugs, But I'd just love to list a few. Firstly is the search for pleasure. The search for pleasure. I'm not speaking from experience, but from observation. I'm the kind of person that pay attention. And for students, I have noticed that the moment I'd like to start it like this. From their background or on getting to school, as humans, normally our brains, we are hardwired to seek consolations, to seek anything that will at least diffuse or that will at least kill down the emotions or the pain we feel. So firstly is the need for pleasure. So most times, according to what they've been indoctrinated, that from friends, from peers, that there's this substance. So I think it has been helping me. When I take it, I usually feel really cool. I think you would want to take it too. So for people that are not so informed on the negative effects of it, in the need to be cool, to feel fly, like they end up resorting to taking drugs, and most times aware or even unaware of the negative side effects. So firstly is the need for pleasure, and secondly is your peer. I'm of the opinion that you are an average of the amount of people you spend your time with. So as a student, as freshers, as secondary school students present here, this is me saying you should curate who you spend your time with, because people, and I've done my study, a lot of times they resort to drugs, they resort to this hard substance as a result of what their friends are doing. Trust me, you are not bigger than the people you spend your time with. Whatever they do, it's just a matter of time. You will resort to what they are doing. So thank you. I hope I've been able to answer your question. Thank you so much.
Very much for that. There are lots and lots. There are lots and lots of reasons to this peer pressure. However, you've been able to, itemize the aspect of for pleasure. Reasons for addiction, you've mentioned for pleasure, and as a result of the pair, the people your circle basically can affect what leads you into peer pressure. However, let's talk about, it's not just about talking about problems, let's profile solutions to them, which is why we're here. And I would like Dr. Diabo to talk about this. Now, how does you affirm that peer pressure can also be on the positive side? Now, how does peer support contribute to the recovery of drug addiction?
It's already known that bad character will corrupt good manners. So it's important that you know that your peer, once their character is bad, thank you. Once you move with somebody with bad character, it's important you move away on time. There are pairs, as my sister here talked about, that are positive for you, that can help you. There are mentors that God has put there to help direct your pathway. There are parents that are your first contacts that God has put there. That's why you will find that there are so many times when people now start taking those substances, ask them where. As we were still talking with some few days ago, and they will tell you, did your parents tell you anything about it? Some of them, their parents did, but they only tried to experiment. They only felt that their parents were old-fashioned, and they decided to go that way. So it's important that you first to go for the peers that will help you well. There are so many things great, so many great things people are doing. For example, what the organizer of this program is doing, and I want you to celebrate him for that. Please do celebrate him. Helping people who are his peers to move in the right direction. And so become an advocate. We have talked to you, you've heard this. You can also... Thank you, sir. You can also become an advocate that will go to where some of your classmates are, your church member, your mosque members, and talk to them. What we have said, what you have heard, go download it and tell them, and you end up affecting somebody. Then when you also begin to think of things that you will call people together, innovations. Many of the people that started some other things were very young people that got themselves, for example, some of these OPE and some of these new little places that everybody now, even when I go to the market and I want to transfer and they start telling me something 00000, I'm like, which bank is that? Once they give me one of the old banks, I'll say, share a new pay, you know, because I know it will go straight. They may not be able to keep their monies for long there, but until those ones become credible enough for people to trust them. But somehow they've been able to solve a problem. And there are young people who are solving problems. So get involved with community works, community activities, church activities, your mosque activities, your club activities. I'm talking about the right clubs that will help people go in the right direction. Also, if you have begun to take it, stop it. Ask your neighbor, are you taking it? You know, if you have started it, stop it. That's a way to help yourself now. And once you stop it, you can also help other people who are your peers that are involved in it. Then also, how do you help as a peer? Somebody comes to you and tells you, I take it. Don't now go loud it and broadcast the person everywhere. Tell the person that people can see. You know, many times when people think about psychiatrists, and I will tell there are very few. They are the ones you see outside. There are so many things psychiatrists, psychologists take care of that have nothing to do with the madness you see on the street. So tell them that there are psychiatrists that can help them. Or as a peer, somebody tells you that I feel bad and I'm getting into this. For example, one of the things they were talking about is suicide, and one of the reasons people do such things because they get depressed. Somebody that has a low mood, and I'll tell them that there are psychiatrists they can see. And you can be sure that with some of these things, you will be of help rather than be somebody who will make things worse. Thank you.
Thank you very much, ma'am. All right, we are in the era of social media, Dr. Deborah initially. This is an era of, we call it the jet age. This is the jet age, and everybody is so much addicted to social media. A person can be on social media, I don't want to be specific now, from morning till night. Even personal interaction has faded away in our society due to social media. How can these, now, if that is a channel through which youths are getting to engage themselves, how can social media be used to help curb the menace of drug addiction?
Thank you. Okay, so how can social media be of help to curb this menace? Yes. Just as Dr. Oduyebo mentioned earlier, I said we can be advocates. I've seen a lot of people that they can't stand the crowd, to speak. Yet, when they drop peace on their status and their handles, they do a whole lot. They change life, even as touching all ages, across all ages. And then so you can use social media, you can use it as you as an advocate can use social media to influence and curb the menace of drug addiction. Like Professor Oladeji earlier mentioned, that though some content even help to trigger this, and then I share an opinion with her, because I remember talking years back, before social media even became what it is right now. I have one of my senior colleagues that shares that opinion of why talk about sex education or suicide when you would probably prompt other people into action of doing it. And I told him, I said, I do not share that fact with you. But then, now, how do we go about it? Let's watch the kind of content we share. Don't say because it's interesting, you also like, share, and then before it goes viral. Let's see how we can streamline it. That content, is it educative in nature? What exactly is it? I like that content, that part where, I don't know, these several videos where you see this guy eating his head after taking stuffs, eating his head and almost killing himself. I like that part because that's just to say a one-off. This is one of the things you get when you go, take drugs or get addicted into this. Just that one-off. You don't necessarily have to show the player aspect of it. However, so using it as an advocate, using it to break the silence, using it to raise the voice of people, and using it to reduce stigma. We talked about cancer and call lines. If you have call lines around you, because one thing I've noticed about what's happening here around us is the fact that people they lack information. People don't have the necessary knowledge that they need to help themselves. So probably you have, for instance, we are all here, you must have gotten one call lines or the other as to who to call, the next line to hot lines. Please, rather than keeping it to yourself, share it on your WhatsApp status, share it on your IG handle, share it on your TikTok handle. Do all of it. And these are things, in your own corner, in our own corner, that we can use to influence, people to curb the menace from using social media. Thank you.
Thank you very much for that. Dr. Oyewale, I would like to look at the angle of the community now. Where does the community come in curbing the menace of drug addiction? There was a time we had a conversation and I heard you saying, talking about therapy now, like what religious leaders get to do. They get to curb or keep their, in quote, captivate their victims. How does the community, what is the right channel the community needs to do? Where does the community come in curbing the menace of drug addiction in our society?
Thank you. One of the challenges of our 21st century is the attrition of what we call the family life. We are strongly nuclear. Me, myself, and I. Myself, my wife, my children. Nobody has any role in their upbringing. It's so bad, I don't know whether it happens to our teachers. If you discipline a student, you will see the mothers, especially, coming to fight the teacher. And especially some of these highbrow private schools where they think they are paying a lot of money. So they are coming. They don't know that parenting is peer-reviewed. Yeah. Nobody can absolutely parent a child. You come with a principle of parenting. When Tumishe was in the college there, he had many parents, and I told him, I said, a good number of my colleagues will be interested in you. You can't afford to come late to class. Others can. Because when they see your tag, they say, oh, why are you coming now? So, and I said, I don't expect you to have an attitude that they can't correct you. So we've lost communal parenting. And one of the facilities that can curb drug abuse is communality. Because we live in communities. In our communities, we know children who are smoking. We know them. But they say don't talk about, don't leave the boy. You say the mother, if you don't want to be insulted, just leave the boy. It's a wrong concept, because parenting requires that your colleagues, your friends, the people in your community, which is part of our tradition, also buying. Nobody in the community will be influencing another person negatively, and if you are doing that, the community is alert. No parent knows everything. His son, when he got to the college there, I see him occasionally. I say, come here. Where are you going? He attends the same church with my daughters and all of that. So what I'm saying is that communal living, you Gen Zs, you don't believe in big families again. Why? You are not an island. When some of you wants to get married, it's not even your father that will take you to church or to mosque or in the traditional. It could be your father's senior brother. Are you aware of that? There's always the... Do you people know? Eh? They don't know, you don't understand the culture. If my daughter wants to get married now, it may be my senior brother that comes on behalf of the family. What that is telling you is that you are not just responsible to your parents alone, but to the bigger family. You bear family names. Do you understand? Those family names have legacies to protect. And when they see that you are misbehaving, they want to curb you. So for me, I think these traditional values, cultural values can help in safeguarding. I mean, I can discipline his son. I don't need to take permission from her. If I feel that he's doing something that I don't like. That is what it should be. And it will help a lot of you young people to know that you are not just belonging to your parents alone, you belong to a family. Bigger family. There's professional family. There's religious family. Abi? There's cultural family. And I think is one thing that you young people should recognize, and we parents also need to recognize. Thank you.
Thank you very much, sir, for that. I would like to look...
Sorry, before
yes,
you go,
yes,
can I just make a comment? Because I need to just say some of what he has just said. Because it's what he's done is acted like a legend. And we need to pass on some of those things that used to be, that helped us. In my own days, if your mom's friend finds you doing what is wrong, they will beat you, then they will tell your mom, Diola, that's my name. Diola Shebai, Bomuti Noema Nomo. So the mother will say, your mom will thank her that she beat you, but they will still beat you. Because they will say you went to shame them outside. But you know that helped our character and our behaviors. And let's promote some of these things. Don't let it be that, what's our business? Even in church, I've had parents who came to report another woman, saying, because my daughter pushed her daughter, she beat my daughter. Anyway, and this I was thinking, she beat your daughter. Your daughter was the one that pushed the other girl. So in that, some of our middle parents have helped other parents to say, don't touch me. You should know that you can't be all you should be alone. Thank you.
Thank you very much for that. All right. Now let's look at it from the student's angle. Now, daddies have spoken about how it has been done, back in this, and they are passing it on to. Remember when we started, I was saying something about passing it on, isn't it? Now our daddy and mommies are passing it on to us now. So we need to do what? Everything good we are learning, we do what? We pass it on. Now, if a daddies have spoken about discipline and Keshi, wani ene kalumbi mo igba abiboni toto shebi owe nwaju enya agba. However, from the angle of students now, there's an adage that says, when there is a will, there is a way. Regardless of external, control and all that, if that person is not willing, nothing will happen. How does a person who is assuming an addict, what are the steps you feel a young addict should do in order to cope this menace in him or herself?
Okay, thank you very much for the question. It's a good question and it's equally challenging too. Okay, I would love to answer it like this. I believe that self-deliverance is the best form of deliverance. Because trust me, we can come for this convivium, we can come listen to talks, go on to YouTube, watch all the YouTubers have put out and still not change. Trust me, I'm not living proof, but I mean, I've done my observation and I've seen. So yes, self-deliverance is the best form of deliverance. But for a drug addict point of view, from a drug addict vantage point, I believe that firstly, you must be aware. You must be self-aware. I preach about self-awareness everywhere I go. I mean, everywhere I go. So yes, I preach about self-awareness. So firstly, you must be aware that this nicotine substance, this drug I'm taking, it makes me euphoric. It makes me feel really good. It makes me feel like I'm on top of the world, but it's short-lived. Meanwhile, I'm coughing. I'm coughing like my lungs is about to explode. I'm coughing like, I believe you understand. If I go to the hospital, they'll tell me I have XYZ stage so cancer, and come on. There are people that are really addicted, but before you can break free, you have to be self-aware. Like I said, self-deliverance is the best form of deliverance. You have to be aware. And in your inner heart, say, I don't think I can continue like this. Because actually, there is no, excuse me, the pleasure is short-lived. And since it's short-lived, there is no end to it. Trust me, there is nothing. So you have to be self-aware and be wise enough to understand that God has made us, God has made men, God has made people to be social creatures. You cannot do it on your own. You are drug addicted and somehow you don't know how you got there. First is to be self-aware, and secondly, reach out for help. Reach out for help. Like I made mention of self-deliverance, but again, you need help. You can reach out to professionals because most times when you decide to stop, there's what you call withdrawal symptoms. So trust me, you need to reach out. You have been firstly made to be a social creature by God, meaning you cannot do everything on your own. You are not an island of the whole knowledge in the world. You have to reach out, seek help. And I forgot to add this. I also believe that when the student is willing to learn, the teacher appears. I need you to take some time to ruminate. When the student is willing to learn, the teacher appears. So after you've been self-aware, after you've been wise enough to reach out, it's important that you follow the processes and the instructions that have been given by the professional. I believe that way and that way alone will help you break free from the addiction of drug. Thank you so much.
Thank you for that. Yes, I was coming to you on. Okay, you want to? Yes, go ahead.
I just want to add this to it because we're looking at it from the context of just the person.
Yes.
Now, seeing the students' community as a community. Now, how do we influence? How do you help these people that are into it? I tell students, there's something I tell my students. I said, look out for yourselves. You know, there's something I noticed lately among students where they tend to see behaviors that are not acceptable, but they keep quiet about it because they don't want to be called a sly. Not knowing that you are not helping. If you have an information and you're not saying it to the right person, then you're not helping. You know somebody around you, you know a roommate that is into drug, that is deeply into it, and you are keeping it to yourself because you feel that the school, in quotes, may send the student out. It doesn't go that way at all times. You know, at times speaking out, there's always the right person to talk to. Talking to someone about cases, in fact, I've had lots and lots of students come to me, and once they give me the code, if a student they'll just be like, I get a class, and the next thing, it's just from lectures, and the next thing, see me, and we're gisting, and the next thing, something comes up, and this discussion comes on the table. And then, but they will not know that somebody has given an information because you will never be able to trace. So just know that there's someone that is willing to help that person. So I don't help the students to keep information that can help them. So speak out if it requires. If peradventure it requires that the school authority gets to know, please don't beat yourself too hard. Because the truth is, what if the person graduates off that habit, and tomorrow becomes a terrible person? Then is that the conscience that you want to get yourself off? So please, let's be our accountable partners. Thank you.
Thank you very much for that. As we are wrapping up this segment, I would like to put this to Dr. Oyewole. You are a spiritual leader, and I want to look at it from that angle. When Ife was talking, he said, when you discover yourself, reach out. Now, how does someone respond to a drug addict? Let's say, for example, a student reaches out to a student. How does such a person, what would be your counsel to that person in order to help a drug addict who reaches out to another student to help him out from that particular addiction?
So between students or
Yes.
reaches out to
Let's say a student reaches out to another student.
Yeah.
He wants, if I just gave a suggestion of reaching out. Now, a student decides not to trust his lecturer or any other person, reaches out to another student. How should such a student react?
Yes, thank you. Among the students, you know those who smoke and those who don't. In fact, some of the girls have boyfriends who smoke, Abi? And then they interact, or the other way around, and they recruit them. I think genuine love is creative, Abi, is protective, and is preservative. I wouldn't want any of my children to take substances to function in life because I know it causes mental illness. I know it will not help them to achieve their goals in life. When I have them in my ward, I tell them, I said, the way you are going now, you are going to drop out of school with drug. Your siblings are trying, but when it gets to a time, they will leave you. When you go old, you may not get married. You may not have a family. With time, when they come home, you will beg them to give you money. Because the chemicals go to your brain, and it disturbs your brain to function. So if there is no mental illness history in your family, abusing substances is the fastest. If you want to kill your parents early, start taking drugs. Your mom will have hypertension, stroke, and she will die. Your dad, if you see parents, I'm sure you see a lot as a psychiatrist. When you see parents, successful parents, so-called, children have destroyed them. When you see a dad not crying and is sweating, the mummies will cry. Do you understand? And if you have never seen a mentally ill person watch somebody who is abusing substances, you'll be hearing people that you are not seeing talking to him, isn't it? Laughing, dancing, or behaving aggressively. Why am I painting all this? If you love people, genuinely love them, you will not want them to go into drug. Abi? When they now go into it, you want to help them genuinely that they can be helped. Is that not so? So it's not a time when you make fun of them. It's not a time you want them punished. It's not punishment. Like Dr. Mrs. Oduyabo said, it's a disease. It's an illness. So what you should do is to find a way to help. Some of them have parents. Some of them have guardians. Call them. Rather than gossiping about, see that person is smoking colos, you will soon become colomental. No. Call the parents. Call the guardians. Call the uncle. This is what I have confirmed so and so person doing you. And they have told us it can lead to mental illness and we will get out of the university. Please, I don't want him to know or get angry. If there's a way you can find a means to take care of him. The university authorities also have channels of communication. So rather than gossip, if the person is your sibling and you don't want that person to be destroyed the way I was describing it, or to kill your parents or their parents, you will take rational, creative steps and it will guide your reportage of those cases. Thank you.
Thank you very much, sir. Thank you for that. As we wrap up, your final...
Sorry,
okay.
I just want to give a story. You know, when Dr. Oyewole talked about killing parents, I know of one. This person got into one of the universities, and then he said the end of year party, he got introduced to the use of cannabis, and he began to take it. Between that time and last year, and this year rather, he had been affected mentally. He had moved to 2 different schools. He was expelled. The first was the public federal school. The second was the private school where they were paying $1 million plus. He lost that. They expelled him. His mom died this year. The mom died this year. The mom cried many times. And he's still not out of it. He's neither in school, neither is he being trained. He has moved from one rehab center to another. He spent 7 months in Kadam, moved from Kadam, moved to NDLA when they felt that his behavior was out of hand. From there, he moved to Osun and all that, and he's been like that. In fact, even the father is finding it difficult to have anything to do with him because people are saying, the way he killed your wife, he will kill you too.
Thank you very much. As we wrap up this segment, I would like Dr. Deborah Onishile, your final thought as we wrap up this segment, please.
Thank you very much. I'm sure we have all heard, and from all that we have heard and said, I want to tell you this. Don't bother to do drugs. Don't do drugs. What did I say? And you know, you're either doing it actively or passively. I know some people that, you know, mix marijuana with their noodles. They don't smoke. They've never smoked. Marijuana, noodles, Indomie noodles. They have never smoked before, but they enjoy it in their noodles. But then, what am I leaving you with this afternoon? Don't do drugs and don't encourage it. Thank you.
Thank you very much. Ife, your final thought, please.
Okay. I would love to conclude by saying this. Drug abuse and drug addiction is a really debilitating and a really, I should call it a canker worm that has eaten deeply in our society. So I would, firstly, I would want to commend the Still Waters Mental Health Foundation for the convivium, for creating a space. But I would also love to say this. If as students, if as individuals, if as parents, if as professors, lecturers, as foundations, if we believe or if we say we care about our youth, if we say we care about our students, then it's important that we take care and that we at least imbibe in our children and students the idea and the information or the wisdom that is needed. I'm ending like this. If we care about our students, then we must make sure they grow because they are the minds for the future. We must make sure that we build their minds because they definitely are the ones that will build the future. Thank you so much for listening.
Thank you so much. Please, ladies and gentlemen, put your hands together once again for our panelists as they go back to their seats as we wrap up this segment. Please, if you want to clap, clap very well. Thank you very, very much. And at this juncture, we'll first of all appreciate our panelists, then we'll have 1 or 2 questions as we are wrapping up this segment. Please put your hands together as I make welcome Dr. Oyewole Jr. for the appreciation for our panelists. Thank you. Please, the LOC committee, please come and help us with the chairs on the stage here. Thank you.
Yes. The program is gradually coming to an end. I want to appreciate the panelists. We thank you for bringing your wealth of experience. We thank you for the time and commitment that you put into this discussion. And we pray that all of your efforts will definitely yield good results by God's grace. Can I hear an amen? Yes, so we'll be having the award presentation for the panelists. Let's give a round of applause. Yes, so I'll be calling some people to present the awards particularly. Yes, so please, let's have the #1 student in Osun State University, the SUG president, in person of Imole. So please, let's give him a, this is your president, oh. #1 student. You guys don't know him. Please, let's give him a round of applause. Okay, we'd also be having the president of the college from Ijebu-Jesha, am I right? Ikpetu Ijesha, sorry. So please, let's have you in front. Let's a round of applause for her. A woman president, a woman leader. Please, let's give her. It's not easy. It's not easy. It's not easy. Okay, then we'd also be having Dr. Oyedeji, the Africa coordinator for DC Waters Mental Health Foundation. Then last but not the least, we'll be having the vice principal of our very, very wonderful secondary school here. Daddy, please, can you come out, sir?
Mrs. Vice Principal, ma, please.
Please, let's give her a round of applause.
Okay, we're represented by the teacher of Nuruddin. Thank you very much, sir.
Of the greatest Nigerian students. Good afternoon, everyone. I appreciate the initiative behind today's event for bringing these kind of events that enlightens the youths. Thereafter, I would love to present this award of recognition to Dr. Deborah Onishile, Head of Department of Nursing Science, Redeemers University, as a panelist at the Osun Mental Health Summit 2025. Thank you.
Put your hands together once again, please. Thank you very much for that. Thank you very much, ma'am. We really appreciate you for coming.
Having appreciated the organizer of the program, I would like to make my presentation to present this award of recognition to one Dr. Adeola Udu Yebo, Consultant Psychiatric Osun Teaching Hospital, Osogbo.
Please clap very well if you are clapping.
Osun Mental Health Summit 2025. Round of applause for mommy, please.
Yes, please. The photograph, please. President, join.
Yes, ma'am.
Thank you.
Good afternoon, everyone.
Good afternoon.
So I'll be presenting this award to FA God's Power, fourth year medical radiography students of Osun State University, as a panelist at the Osun State Mental Health Summit 25. Thank you.
Please clap if you want to clap. Nah, whatever is worth doing well. Thank you very much. Thank you. Please applaud him once again. Let's appreciate him. Thank you very much.
Okay. Good afternoon, everyone.
Good afternoon.
Yes, so I'll be presenting the last award to our father, our mentor, the father of the convener of this great event, who happens to be a father and a role model to both Dr. Ewole and to myself. In person of, I'll be presenting this award of recognition for your service and commitment towards the success of the Still Mental Health Foundation Osun Mental Health Summit 2025, and it's presented to Dr. Adeoye Oyewole, popularly called Dr. Oyewole Senior.
Put your hands together.
Head of Department of Mental Health, Ladoke Akintola University Teaching Hospital, Ogbomoso, Oyo State.
If you are clapping, clap very well. Thank you. Please, all the panelists should please come to the high table for a group photograph. Should come up to the stage for a group photograph, please. Thank you. TSW. TSW. The little will do is more. TSW. The little we do is more. Put your hands together for yourselves. Thank you very, very much. At this juncture, I want to call on the African coordinator to give us a closing remark as we come to the end of this event gradually. Put your hands together as we welcome Dr. Oyedeji Oche for the closing remark. Thank you very much.
Yes, good afternoon, everyone, once again. It's a great pleasure to be here and to give in the closing remark. First and foremost, I would like to appreciate all our invited guests, in person of the Vice Chancellor in absentia, ably represented by the Deputy Vice Chancellor, the keynote speaker, Professor Bibilayo, all our panelists, our Vice Principal from our secondary school, Nasaruddin, and our great teacher also. I would like to appreciate the Students' Union Government President and every other executives that is present here. I'm aware that all college presidents are here and some faculty presidents are also present here. I want to appreciate everyone for being here and all the local organizing committee members and every school student that is here, freshers, stay-light, secondary school students. I appreciate you all, and on this note, I want to appreciate you for coming for the symposium, and I'll be giving the closing remark as we close up the event. I'm sure we had a nice time, and I'm sure we're going to have fruitful moments from now. Thank you very much.
Please appreciate very well if you are clapping. All right, at this juncture, we are wrapping up the event.